Okay, well, welcome everyone. Thank you so much for your patience as we troubleshoot all the things that Zoom always throws at us. We're really glad that you're here with us. So I'm Wendy Noss. I'm Executive Director of the Consortium of Social Science Associations, and this is COSA Headlines. It's an opportunity we provide to our member organizations to engage on topics that are timely and of importance to the social and behavioral science community, and that often includes engaging with our friends in the federal agencies who can tell us what's new, what's happening, and what we need to know at those federal agencies. So you're hopefully here because you are a member of one of our member organizations. One of the great things about COSA membership is that if you belong or are affiliated in some way with any of the organizations you see on your screen, be it a university, you're a student, a faculty member, an administrator, or a member of a professional society, you are a COSA member. So it's great that you found us for this event, and hopefully you will come back and engage with COSA more now that you know that you are a member, and participate in some of the other things we have going on, which I'll talk about towards the end. So stick around for that. If for some reason you're here and you are not affiliated with one of our member organizations, that's totally cool too. But know that it is really easy to join. There's a small membership dues fee, but again, that's paid by the organization. So if you didn't see your university listed, we would love to add to our family of universities or scientific societies who partner on COSA activities. Just to save the date for our next headlines discussion, next month we'll be talking with Dr. Rob Santos, who's the director of the Census Bureau, and a longtime friend of COSA and the social science community. And that will be at the end of May. So hold the date for that. I don't believe we've opened registration for that one yet. So just watch your email or social in the coming weeks to get registered for that one. And please share as well. The challenging thing about our membership structure is that we don't have access to the entire social science community. We have access to a couple of people at your institutions, but not everybody. So word of mouth is really important when it comes to sharing events like this. So please do share these things as they come to you. So like I said, I'll say a few more things towards the end about how you can continue to engage with COSA and some of our ongoing activities outside of these webinars. But that's not why you're here today. Today, you're here to hear from our special guest, who is Dr. Jane Simoni. She's the Associate Director for Behavioral and Social Sciences Research and the Director of the NIH Office of Behavioral and Social Sciences Research at NIH. That's quite a mouthful. I think I can still say that you're new. I hope she thinks she's feeling settled, but I don't know. We work a lot with NIH and OBSSR. They're a tremendous group of people who, with a huge charge and a tiny budget, but they do such important work to integrate social and behavioral science across all of NIH, and you'll hear about that today. And really just fortunate that Jane has taken this role and has agreed to speak with us today. So if you hold on for just a moment, we will get this set up and then we will hear from Dr. Simoni.
Okay, how's that? Can you see the screen?
Perfect. Well done.
Okay. Alrighty. Well, hello and welcome everybody. I'm thrilled to talk to you about OBSSR, the Office for Behavioral and Social Sciences Research, which I did just join as director this summer. So it does still feel very new. They say it takes about 3 years to learn this job. So I'm still, I feel new, and I'm still open and excited about what I can learn from groups like you as well. So I hope this is a very much of a bi-directional exchange. I'm going to talk for a little bit. I don't think it'll be more than 20 minutes or so. And then I hope we'll have some time for discussion after, and happy to take any questions you have about the work that we're doing here. So a bit about me. I did join this summer. I have a dual role. So it's both the director of the office as well as an associate director at all of NIH in the Office of the Director for Behavioral and Social Sciences Research. And I came out of academia. I was at the University of Washington for 23 years. And before that worked in Yeshiva University, had postdocs in Columbia, trained at UCLA, and did a lot of research in the HIV field, but health behaviors broadly. And towards the end, most of my career was at the intersection of the biomedical research in HIV and the behavioral components of it, like medication adherence, mental health, substance use, trauma. So I felt very natural to come into this role at NIH, where my role also was trying to bridge the biomedical research enterprise, which really does predominate at NIH, with the behavioral and social sciences that we have here. I'll start with a quote from a former director, Dr. Francis Collins, who said, upon reflecting on his tenure, that maybe we underinvested in research on human behavior. And as Judy Auerbach says, this is the oy vey heard around the world. Yes, after COVID, with this incredible mRNA vaccine, still only about 1 in 5 American adults had received any COVID-19 vaccination. And this was in a much larger context of ignoring behavioral and social science research and how it undermined the broad US response to COVID-19. And this is true in the HIV field as well, where I worked. Without attention to the behavioral and social sciences, the promises of even the greatest biomedical breakthroughs really can fall short. We know with oral preventive HIV medications really could be a game changer, but there's been much slower uptake than one would have hoped. Initial resistance from care systems, stigma in the community, lack of timely information. Also in the voice trials, our new director, who just took Tony Fauci's place here at NIAID, learned that you can't determine a product's efficacy. This was for women and using microbicides and vaginal rings to prevent HIV. If people don't use it, you're not going to find out about it. So the behavioral and social sciences are really critical. And this is true in all different areas, beyond infectious disease, beyond HIV, that BSSR, the acronym, shapes health policies and improves health outcomes in so many different ways, helps to reduce health disparities. It's been used with smoking cessation, physical activity, and diet and exercise, certainly vaccination campaigns, as we talked about, mental health, and in my own research and adherence to medical treatment. And I had a colleague, a physician, who said that whenever you intervene with a human being, there is some kind of behavioral science involved. So every actual biomedical intervention with a human is really a biobehavioral intervention. And that was the theme of the work I was doing before I came to this office. And it remains an important cross-cutting theme of the work I'm doing now. So who are we at NIH? I have to say, I didn't know a lot about this office, even in the years I was an academic, but it was created by Congress with support of folks like you, actually, showing Congress the need for it. In 1993, opened doors a year and a half later in the summer of 1995. Norm Anderson was our first director. And our congressional mandate was to coordinate the health relevant behavioral and social sciences at the NIH, and then to identify challenges, gaps, opportunities to advance these sciences here at NIH. And in terms of the organization at NIH, I don't know if you can see my pointer, but up at the top, Dr. Bertinoli, our new Office of the Director, she's our director, and within that office, we are within the Division of Program Coordination, Planning, and Strategic Initiatives under Tara Schwetz, and we have 16 offices, and we are one of those offices. So most of you are more familiar with some of the institutes that actually fund the research at NIH. So all the 24 funding ICOs are also within the office, but we are directly within the Office of the Director for the Behavioral and Social Sciences. So we are not a grant giving office. So we do co-fund activities. I can tell you a little bit about this later, but we work very much in partnership and parallel with all the IC and other O's, all the institute centers and other offices. So our team, we have Janine, I'm a clinical psychologist. Janine Simmons, our new deputy director, is a psychiatrist and a behavioral neuroscientist. Wendy Smith has worked with us for a decade. Is an experimental psychologist. Roz King is a demographer. She's the chief of our scientific development and coordination section. Katie Morris is the chief of our policy planning and analysis section. And when we're fully hired, we have over 25 FTEs. And you can see here a diverse group in terms of the work that we do in terms of their training. And I have to say, even probably more than other offices at the NIH, the staff really are the engine of what we do. We have a very much a teams-based approach, but we are collaborative. We work with different members of the team on different projects. And it's very much driven by their initiative and hard work at fulfilling our mandate of looking at gaps across the NIH and finding ways that we can step up and intervene. Our budget, I mean, we'll put in context to the annual budget of the NIH is $45 billion. It's clearly the largest single public funder of biomedical and behavioral research in the world. And our budget's much more modest, 41 million in FY23, but it has increased steadily with a big bump during the COVID epidemic. And most of our budget, 3/4 to 80% of our budget, is directly invested into NIH funded research of the highest quality BSSR that's consistent with our mission, and that is administered in cooperation with one of the different ICs. So you can see our co-funding, it's like our co-funding amounts by fiscal year have risen over the last few years from 20 million to 32 million, again, with that big bump during COVID, thanks to congressional increase in our annual budget. And then if we look at a snapshot of 1 year, so looking at FY23 last year, across, these are the institutes at NIH, you're probably familiar with mental health, aging, minority health and health disparities, cancer, and here's NIAID, infectious diseases. You can see that most of our co-funding goes, as it's probably makes sense, to NIMH with 21 separate projects. But it does vary. We have a lot of money invested in aging as well, health disparities across the whole continuum at NIH. And what are our scientific priorities? So we have this money that we can invest and we can co-fund in different areas. And there are 5 areas that the office has been involved with, and I modified slightly when I came in this year. So, and these are in no particular order. But the first here is behavior change. How do you change behaviors? You're interested in increasing healthy behaviors. How do you maintain them? And what are the theoretical mechanisms and actual underpinnings of how you change behaviors and how you have impact? So we're interested in theory-informed research on the initiation and maintenance of health-promoting behaviors and their mechanisms. And these can be basic behavioral, physiological, or more psychological that underlie behavioral interventions that promote health. So that's a very important part of what we do. And we look for research across the institutes, might be in cancer, might be in aging, might be in heart disease. But we here at the office we say disease agnostic. It cuts across all the different institutes, all the different diseases, that we are interested in the core behavioral and social science functions. The second, social connection and health. You know, one of the impetus for me going into this job was I have a child who's now 21, but going through high school and college during the epidemic. Some of you know who had any impact with the school age or college age children at the time. Very difficult on them with the school closures, the social distancing. And that was really a motivation for me to look more at the social connection and health. And this is some work that also that the Office of the Surgeon General has been doing. So we've been in touch with Vivek Murthy's office on their work in this area, examining the role of social relationships and interactions, whether this is in dyads, families, or other social groups on health. We're looking particularly at the mechanisms through which social isolation or connectedness can accelerate or impede biologic and other disease processes to affect the execution of health behaviors and the impact of overall health and well-being. So a lot of this work, as you know about, has focused on technology, social media, especially for young people, and how that's had an impact on their health. So we are very interested in that kind of research. When the institutes come to us and say, we want to fund this work, we've funded what we can in terms of our budget limitations for the year, can you help us look at more research in this area? This is what we're excited about doing. And also the other priority areas, one is multi-level research. So much of the research in BSSR has been individually focused, especially the behavioral science side of this, not so much the social. But we really want to expand this to look at multi-level influences on processes. So these could be at the biologic, intrapersonal, interpersonal, and social, the community, organizational, structural, environmental, and even policy levels. And we understand that work is not easy to do, but it's very important. And it fits also at the NIH with an increased emphasis on social determinants of health. And I know people didn't always see the NIH as being a big player in that area because we focus so much on the biomedical aspects of disease, but social determinants of health is a committee that I co-chair with Elisa Perez-Stable and Shannon Zank in nursing and minority health and health disparities to really look at social determinants and what their impact is on disease and health promotion at the NIH. So very interested in that area. And the final two, one is integrating BSSR into biomedical research. You can see with what I've said so much about NIH being predominantly a biomedical research institution, that we're looking for finding ways that behavioral and social sciences can really facilitate the work of the institutes, even in these areas that have been primarily seen as only biomedical. Remember the mantra, any biomedical intervention with the human being is really biobehavioral. And that's the message we're trying to talk about across the institutes. How can you incorporate behavioral science to facilitate, behavioral social science to facilitate what you're doing with your research portfolio? Because remember, I have a budget of millions of dollars. The institutes, many of them have billions of dollars to focus on a particular area. And if we can just look at a fraction of that research and include a behavioral social component to it, I think we can really expand not only the success of the work they're doing, but improve behavioral and social science research. And finally, health communication science. This was really apparent during the COVID epidemic as well. Research that examines the effects of health communication on behavior and health outcomes, both at individual and group levels. Research that examines the evolving communication ecosystem and the processes of trust are of particular interest to us. So research on health, science, and media literacy. What do you read online? What can you believe? Once we have messages that we want to convey, what is the best way to do that? How do you make decisions under uncertainty, giving health information, and how to communicate a way to do that? Patient-provider communication falls under this rubric. Traditional media and newer communication channels like social media are also very important to us. So those are the 5 areas I talked about: behavior change, social connection, and then this multi-level research, integration of BSSR into biomedical research, and health communication science. All right, so look at we just are writing our new strategic plan now, 24 to 28. It was held up in the transition from the acting director to myself, but as we speak this week, it's being approved at the higher levels at the Office of the Director here at NIH and should be out soon. And our strategic priorities, as we wrote in the report, are involved in research, capacity, and their operations. So in terms of research, they are synergistic inquiry, innovative investigation, and then implementation and impact, really accelerating sustained adoption of BSSR findings into practice and policy. And the synergistic inquiry has to do with both the biomedical enterprise, integrating behavioral and social science research into that, but also the basic BSSR. So we are interested, we don't just do clinical applications of behavioral and social science research. We are interested in basic behavioral social science research, which includes a broad portfolio of research in cognitive and behavioral neuroscience. And we're interested in the integrating, so not only biomedical and behavioral, but basic and applied BSSR. And then in terms of innovative investigation, we want to look at measures, we want to look at designs, we want to look at new data analytic approaches. So 3 different areas. I'm particularly excited about artificial intelligence and how that's going to change what we do in terms of our research investigations, especially for behavioral science, with the potential to include and expand measurement and assessment capacities. In terms of our research priorities around capacity, we want to develop and to diversify the BSSR workforce. That includes both in our own office and within NIH and beyond. So we're looking at, we'll talk about some of the research priorities that we're looking at. But finally, operational. Uphold the values of DEIA in the work that we do, both the research we encourage and the processes for bringing that about at NIH. We want to build equitable partnerships and collaborations, and we do that at NIH. We have a coordinating committee consisting of representatives from each of the institutes and centers. And we're also building partnerships like this with COSA, with FABs, with some of the individual organizations as well. And then finally, I really want to focus more on enhancing our communication, both among scientists, but also with the public in general, being a little bit more outward facing than we have been in the past. And finally, we have a cross-cutting theme of health equity that really touches on all the work we do, and the kind of research we support, the way we support it, the kinds of partnerships we build. We believe everyone has a right to have an opportunity to have good health, physical and mental health outcomes, and health equity is important to us in every kind of science that we pursue. In the strategic planning process that we did, we first looked at what we've been doing. I reviewed the progress for the last 5 years, and this started 2 years before I came into the office. So we identified future directions and frameworks, and then we went out to the community. Remember, I said these partnerships are important to us. So we had 2 requests for information, one with inside the NIH and one with outside, looking at extramural researchers and other external communicators and collaborators, really trying to get them to tell us what they would like to see us do, what were their needs, and how we could better fulfill our mission. And then we collected feedback from internal to NIH, held listening sessions, collected input. Remember, I said we had that coordinating committee, so we were able to speak with our representatives from each of the ICs to tell us what they needed to see. And then we refined our priorities and objectives, really just an iterative process of multiple drafts. We synthesized the feedback and came up with a final strategic plan. And then what was very helpful with this was our council of council. So every IC has a council, and at the office of the director, we have a council of members across all of those councils. So they engaged in a working group to give us feedback on how better to integrate behavioral and social sciences research into the NIH. So that was very helpful, and that informed a lot of what we were doing in our strategic plan. And will actually influence what we do in terms of our implementation of that plan. We rewrote our mission and values this year, and our mission, based on, we're within the guidelines of our congressional overview, to enhance the impact of health-related behavioral and social sciences research in 4 different ways, really. First, we have to identify projects that we really should support, and then we should develop and coordinate with the ICs to do these projects and initiatives. We should integrate BSSR into the larger NIH, and we should communicate these significant findings both within NIH and beyond. And our broader vision then is a world in which the synergistic integration of BSSR with biomedical research leads to accelerated scientific discovery, effective treatment and health promotion interventions, and equitable implementation strategies that will improve health for all. So new mission and vision statements this year. I wanted to get some of a little bit more in detail. This big picture, what do? We integrate behavioral and social sciences. Well, how do you actually do that? Well, the BRAIN initiative that Obama started in 2012, I think, is a huge neuroscience project, basically, but had very little that specifically touched upon behavior. So we have started a whole initiative around brain behavior, quantification, and synchronization. So how do you develop and validate next generation platforms and analytic approaches that will really be able to help us quantify human behaviors and link them with simultaneously recorded brain activity? So we're not just interested in the brain or neuroscience for its own sake. We want to see the impact on behavior, and to try to separate the brain from outside behavior, it's just not possible. And that's what this work is doing. Secondly, we are helping to administer $12.5 million a year of congressionally appropriated monies to look at firearms violence research. And this, there had been, with the Dickey Amendment, had limited the extent to which CDC and then later NIH could specifically spend money on firearm policy. But this is very clear. This research is to support firearm injury and mortality prevention by taking a comprehensive approach to studying underlying causes and evidence-based methods of prevention of firearm injury, including crime prevention. Excuse me. So very excited about this research that was just approved for another year. We also have a committee, the Executive Committee for Basic Behavioral and Social Sciences Research. This was formerly funded under the OPNET, the Opportunity Network for doing basic research. And basically the Council of Councils said, hey, we understand a lot of you are doing, implementing more applied clinical applications of behavioral and social sciences, but don't forget the basic research. And this committee is involved in a lot of the work we do that's very basic, like the BRAIN initiative. So it identifies cross-cutting basic social and behavioral research and areas and publishes funding opportunities to really stimulate this kind of work. And what we do is we meet with the different centers. We have a co-chair from NIMH and Integrative Health that's going to work with us to see where the institutes really want to invest money. That's very basic, but also has the behavioral component. So we're working on that now. And then our final example is our social, behavioral, and economic impacts of COVID coordinating center. And this was a huge part of our work in the last 5 years to provide a nexus of communication for COVID-19 related research, streamlining some of the information sharing across the behavioral and social science community. We gave out NIH awards or helped administer those and the public. So this meeting actually is coming up next month in Michigan to look at where the coordinating center is focusing a lot of the hubs that worked in this area. A lot of that work will be leading broader as we come out of COVID into a more general emergency or pandemic preparedness approach. A couple other examples, research and application in team science. We're very interested in interdisciplinary and team science, and the National Academies of Science, Engineering, and Medicine consensus study just began to identify how to best support team science. So how do you develop, support, and integrate diverse teams with members? And that's what we need for the future of work, we feel. So very committed to a team science approach. And then we're also working on ontologies. We just got a round of applications to study ontologies, which are really structured ways of organizing the information and research, the vast research we have on behavioral and social science, as a way to accelerate behavioral science. So we're working on that right now. And finally, in training, remember one of our operational capacities or capacity priorities was to look at diversifying the workforce. So how do we do that? We have a T32 training model. So we fund pre and postdocs to do advanced data analytics for behavioral and social sciences, the TADA program, because behavioral and social science research is very complex now, and not all the biostats programs really focus on how much we need to have this for behavioral and social sciences. We have an R25, which is a mechanism for funding short courses on innovative methodologies and approaches in the behavioral and social sciences. These are often summer programs or a year-long program where folks who really want to take a deeper dive into methodologies can do it as part of their studies. And finally, we use administrative supplements mechanism to fund T32 and TL1 training grants to better integrate behavioral and social sciences. So remember I said, I'm looking for opportunities. We have a lot of money for biomedical research at NIH. I want to think of ways that we can facilitate that research with behavioral and social science training. And finally, just a couple more slides, one on communications, what we're doing. We honor Matilda White Riley every year with an annual lecture where early stage investigators and one senior investigator present. That's coming up in May. We have a research festival every year. I'm aiming to make it hybrid this year. In November, we've had a break with COVID that it's been online. We have a director's webinar series where I sponsor individual lecturers to come on a quarterly basis at the NIH to speak about their work. We have a monthly newsletter that comes out and a blog that I write. We have a website with our accomplishments, including a history timeline project, and this is all on our website. Upcoming events is in the very prestigious NIH Directors Wednesday afternoon lecture series, the Walls Lecture. This year it presents the best of science across the world, and this year our nominee, we're very proud to have our nominee who had some kind of behavioral and social science component to her work, was invited to present, and that's the 1st of May. And then our Matilda White Riley lecture will be the 20th of May, where Dr. Bernice Pesco-Salido will be presenting. In June, we have a workshop on the future of scientific conferencing and hybrid and digital avenues for facilitating that. We have a director's webinar on the intersection of social science, aging, and health disparities with Dr. Rebecca Wong. And then finally, Dr. Emily Wong is going to talk about justice involved individuals and access to healthcare in our September director's webinar. So I invite you with this QR code or this web link or these social media platforms to follow us, what we're doing, find out more about the work, be in communication with us. Let us know ways that we can help you and support the work you're doing, and learn about what we're doing and the most recent cutting edge work in behavioral social science. Thank you very much.
Thank you so much, Dr. Simoni. And I would also just second the plug for all of the wonderful resources that OBSSR puts out. The newsletter and the blog are exceptional, and a great way to stay up to date on things. And what I love the most, selfishly, is the success stories that are often included, the outcomes of research. Those come in handy for those who sort of work in the line of work that we do in Washington, where it's justifying the value of this research. Why do we need more funding for it? Because, you know, money counts and money speaks. So those are just so helpful. We're happy to open it up for questions. We have lots of time. I do have one or two while you're getting your thoughts together. I'm curious, you talked about the co-funding nature of what OBSSR does. I'm curious what the breakdown is between ICOs coming to OBSSR saying, I'm interested in doing this research, will you participate or co-fund, versus initiatives driven by your office or the director's office, and having to court ICOs and ask them to engage in these research topics?
That's a great question. And it's the main question I had coming here. Actually, I was surprised to see that the majority of our funding actually goes to the ICOs who come to us asking for co-funding.
That is interesting.
We do have our own mechanisms, our own call for proposals, but yes, we have to go then to the institutes and say, hey, we think this proposal, like the TDA program or the R25s or the ontologies that we did, is really important, but we need you to help us. We're going to go to you. We're going to, the CSR is going to help us put together a review committee. And then we're going to ask you to help manage the grants once we get them, because they'll be run through your institutes. So that is a smaller proportion of our budget than the actual co-funding, where they just come to us and say, hey, we had our own idea. We got all these great applications. We can't fund them all. Can you help us fund part of them?
Yeah. And so the natural follow-up from me then is, because it's so much harder to embed your own things across the institutes and centers, are you funding everything that you want to fund?
No, every year we turn down really good applications that we just don't have the money to fund. So it doesn't, the institutes fund at less than 20%, mostly less than 10%. So there's plenty of good applications that just don't get funded. And even what I feel like, we have a small amount of money, but it's the institutes have so little money that they dedicate to behavioral and social sciences that they're very thankful for the bit that we do put towards their co-funding. So and it takes a while. It's a long process to have a notice of funding opportunity. It will be like right now we're starting to think about new ones. I didn't mention here, but I'm very excited about artificial intelligence and because I mentioned it once, what it can do. And so what would applications look like for that? This is a 2-year process to get this together, to get this passed at NIH. You imagine what a bureaucracy this is. And then to get the announcements out, to get the applications in and fund them the earliest will be in 2-3 years. And by then, look completely different. So it's, we'll have to think about a mechanism that will be able to move with the, this exponential growth and the capabilities of artificial intelligence to enhance our science. So, but Wendy, that is a spot on question. And one I've been thinking about, and I told our staff, I want to lead during the time. So I just started right in 8 months, but in the next couple of years, I want to help us be leading more of our own initiatives, more things that we focus on specifically.
Yeah, yeah, and I think the office is just such a unique model in federal agencies to have a dedicated
Yeah.
office that basically forces the rest of the agency to pay attention to behavioral and
Yeah.
social science.
That was the point. And I think it, really was a lot of, it was outside support of people that just went to their Congress people and said, hey, this is really lacking. And it was, it was kind of visionary in 95, right? Because decade of the brain and everything was fMRI and neuroscience was, cognitive neuroscience, behavioral neuroscience was just developing. But then during COVID, everybody knew, wait a minute.
Yep.
Even Francis Collins says, we really did underinvest in this research.
Yep.
So, yeah,
That is our new favorite quote as well, and we
I
include
know
it in everything we do.
I know they're going to tell me to stop using it probably soon until they
Never.
do.
Never. So if others have questions, feel free to raise your virtual hand or type into the chat. I wanted to ask another thing that the community has pushed really hard for is the firearm prevention funding every year for the last, I guess, 5 years now we might be
This is fifth,
at. And for those who aren't as familiar, this is a congressionally directed research endeavor, and money was provided for it. So which means that it's not coming from the agency. It's not, sort of the discretionary funds of the agency to go and say, we want to do this. And that's for a couple of reasons. One being that firearm gun violence research is guarded in a lot of ways by the Dickey Amendment, which basically says you can't, federal funds can't be used to connote a position on gun control or anything like that, but you can research certain aspects of it. So my question is more, I know because it's the funding is not guaranteed every year because it is congressionally directed, and because appropriations are horribly late every year, this year included. I know it's been a challenge for past OBSSR directors to figure out what they can fund with this specific pot of funding, simply because time doesn't allow for traditional research projects or what have you, and it's not multi-year money, I believe. So I'm just curious, how is that program currently sort of shaping up, and has it moved along into other spaces?
Yeah, that is a great question. Again, totally spot on. In fact, just this week, briefing Dr. Bertonoli, the NIH director, on what we're doing for firearms research. There was I think it was in JAMA, an editorial recently talking about how we need to have more research in the area and what we could do to really support it. And frankly, it is tight to find out in the spring that you have to spend the money by the fall. And we don't have time to put out even more NOFOs, so that people can apply to them, so that they can be reviewed and that we can bring them to council. So we have to be very creative in the kinds of things that we fund. And we have an ongoing a NOFO on time limited or time sensitive research, so that when there's work that needs to be done right now, and we accept that on an ongoing basis. So that's something we look for firearms research. But we actually do look across the institutes, and sometimes they're not even aware of of research funds that they have that we might be able to participate. So often we can sign on to something that's already been funded. But you can imagine the damage that was done with the Dickey Amendment is that it discouraged people. I mean, what person's going to tell a graduate student to go into a field that there's an amendment that says you can't study research, that has, it was limited language. It did say, like you said, that it was not to promote gun control, but people read that very broadly, and they were afraid to go into anything that was related to it, because your whole field could be shut down. So part of what we're doing is trying to develop the infrastructure and to develop investigators that want to work in this area, because I think it's going to be like COVID, with mass shootings, with, hundreds of deaths a week from firearm violence, worse than any other country. It's the importance of it is just impossible to deny. So it is something we're working very hard on, and we wish we did have more of a heads up on it, so we could do an even better job of you know, thinking about longitudinal studies and really preparing for it. Because I saw in one early Senate version of the bill, they talked about doubling it, you know, the amount of research, and again, it doesn't go just to us, right? The idea was it's NIH, but it was for us to coordinate. It's disease agnostic, right? This wasn't firearms for cancer or firearms for diabetes. This was across NIH.
Right.
Yeah.
Right. And for CDC, and for at least 1 year, National Institute of Justice was involved with a little bit of money for that too.
Yeah. We've collaborated with CDC and
Yeah.
NIH.
Yeah. So we'll keep fighting for that, certainly. But I think it's good. It's good for our community to know that the unseen challenges when appropriations are so late. And why it's so important to not only get the numbers that you want to get at the end of the day, but to actually have enough time to spend the money. It's
yes, to do it. Yep, it's true.
Huge challenge. Yeah,
it's true. I see Ian's brave enough to have his camera off. I don't know if he wants to introduce himself or talk about the work he's doing.
oops. Nope.
Nope. Okay, maybe not.
Okay.
Ian Gaines, did you want to say?
Oh, he's part of the COSA team.
Oh, I see. Okay.
Yeah.
You're part of the team. Yep. Okay. All right. I didn't get to do introductions for the. Okay. I see.
Yeah, I was thinking you was talking to another Ian. I was looking through. I was like, is there
yeah.
another Ian in here? Yeah, but I'm part of COSA.
Yeah, COSA. Okay. Yeah, didn't say anything. Okay.
Well, yeah, folks are being shy, but I guess I'll ask one other question if there isn't anything else from our crew.
Okay.
So if folks who are on with us now or who will be watching the recording later maybe have shied away from NIH because it hasn't felt like there was much for them there in behavioral and social science, but they want to get into it. Where would they start? Going to an IC? Going and talking with someone there, to going to OBSSR? What are sort of the good ways to crack into NIH behavioral research?
Yeah, definitely go to the ICs because they are the ones that fund, right? They're the ones that are going to look at the result. They produce the vast majority of the notice of funding announcements and awards. They're the ones that will administer and grant the actual funds. We can sometimes co-sign on to them, but they are the ones that you have to convince that you're doing timely work. So I would look at their NOFOs, look at the kind of work they're doing. And we do print a lot of in our newsletter and our website, you'll see some of the more relevant behavioral and social science funding across the institutes. But, you know, that's a good question. That's making me think about, we should look at their websites of the institutes. So if people actually go to the Cancer Institute, cancer has a huge social and behavioral component, by the way. They have 50 people that work across their area, which is double our office size, to go across the whole NIH, and they do it just for cancer. So, but that's really a good question, Wendy. I should think about that. Do we look at their website, and can you identify what are the behavioral and social science opportunities at their centers? But
yeah, I think that would be useful. It isn't always clear, and there's, you know, bureaucratic language of, you know, this branch or that branch, or
yes, I know. Yes, you have to know individual processes. Who knew that was the branch where at NIA that you had to go to?
Exactly.
Yeah.
Yeah.
Well, I'm going to make a note of that and follow up on that. That is a really good point.
Awesome. Great. Well, I don't see any other hands, so I want to thank you again. And if you allow, we'll share your slides if that
sure.
works for you. Okay. Well, thank you so very much.
Thank you all.
Again soon.
Yes. Take care. Have a good afternoon.
You too. All right. So folks who are still on, let me just finish up with a couple of reminders here. Oops, if I can share my screen. Here we go. All right, so just to finish up, like I said at the beginning, I hope that this isn't the only time we see you at a COSA activity or function. We have lots of things going on, and we communicate a ton of information on a regular basis about everything that's happening in Washington, whether it's in a federal agency with funding opportunities, or no doubt we will be pushing out the OBSSR strategic plan once that's released and finalized. But Congress as well. So much is happening, especially this time of year with funding for agencies we care about. We also follow the elections. So please subscribe to the COSA Washington update. That's the main way that you can get information on everything happening in DC. Save the date, of course, for next month's headlines, where we'll be talking to the Census Bureau director. And you might think that has nothing to do with you, or you don't work in statistics or demography, but chances are you will learn something really important that is relevant to your work. Census Bureau is doing incredible things and have such rich data sets that I think we could all benefit from learning a little bit more about it. So watch your emails for that registration link shortly. And then we're all over social, like all of you, or you can go to our link tree to see all of the latest things that we've been posting on social and on our website, and hope that you'll stay in touch with us as well if you have questions about anything that we're putting out. Here's my email address and our website. So again, thank you so very much for coming and talking with Jane with us today. I hope you learned something, and I hope that we see you in a couple of weeks to talk about the Census Bureau. Take care. Have a great day.